After 60, one of the most dangerous health problems can happen quietly. It does not always start with pain. It does not always show up in the mirror, and many people do not discover it until after a fall, a wrist fracture, a hip fracture, or a sudden sharp pain in the back. I am talking about weak, brittle bones. Many people think bones are solid and unchanging, like the frame of a house, but your bones are alive. Every day, old bone is being broken down, and new bone is being rebuilt. When that balance shifts too far in the wrong direction, bone can slowly become thinner, weaker, and easier to break. This is why osteoporosis is sometimes called a silent disease. You may feel normal for years, while bone strength is gradually declining. Then, one small fall, one awkward twist, or even one ordinary movement can reveal the problem. The good news is this: weak bones often leave clues before a major fracture happens. In this video, we will go through 5 warning signs that your bones may be getting weaker after 60. We will also talk about what you can do to support stronger bones, better balance, and safer movement. Stay with me until the end, because the most important part is not just calcium. Many older adults focus only on calcium and miss the habits that actually help protect them from falls and fractures. Before we begin, this video is for educational purposes only and is not medical advice. If you have pain, a recent fall, a fracture, or any concerning symptoms, please speak with a qualified healthcare professional. Now let us begin with warning sign number 1. Unexplained back pain, height loss, or a more rounded upper back. Many older adults ignore back pain because they assume it is just aging. Sometimes it is muscle strain. Sometimes it is arthritis. Sometimes it is posture. But persistent back pain, especially in the middle or lower back, can also be a sign that the bones of the spine are losing strength. The bones in your spine are called vertebrae. When those bones become weak, they may develop tiny fractures or compression fractures. In a compression fracture, the front part of a vertebra can slowly collapse under body weight. This may cause aching back pain, sudden sharp pain, stiffness, or difficulty standing upright. It may also cause a person to lose height over time. 1 inch of height loss may not seem dramatic, but if you are noticeably shorter than you used to be, or your family notices that your posture is becoming more hunched, it is worth paying attention. A rounded upper back is not always just old age. It may be a clue that the spine has lost some of its structural support. Here is a simple step you can take. Know your height. Many people know what they weighed years ago, but they do not know whether they have lost height. Ask your healthcare provider to measure your height at checkups. If you have significant height loss, new spinal curvature, or unexplained back pain, ask whether a bone density test or spinal evaluation is appropriate. Do not wait until pain becomes severe. The earlier weak bones are found, the more options you may have to protect your independence. Warning sign number 2 is easy to miss: loose teeth, receding gums, or dentures that no longer fit well. Most people separate dental health from bone health. They think teeth belong to the dentist and bones belong to the orthopedic doctor. But your jawbone is still bone. Your teeth are held in place by the bone around the roots. If bone strength is declining throughout the body, the jaw can also be affected. This does not mean every loose tooth is osteoporosis. Gum disease, infection, smoking, diabetes, poor oral hygiene, and many other factors can damage teeth and gums. But if you are over 60 and you notice your teeth loosening, your gums shrinking, your bite changing, or dentures that used to fit well now feeling loose, do not ignore it. It may be time to think beyond the mouth. Dental problems can be a useful reminder to ask about your overall bone health. If your dentist says you have serious bone loss around the teeth, especially if you also have back pain, height loss, a family history of osteoporosis, or a fracture after a minor fall, ask your doctor whether bone density screening makes sense. Bone health is not only about the hip or spine, it is a whole body issue. Warning sign number 3 is the most serious one: a fracture from a minor fall or small movement. Doctors often call this a fragility fracture. It means a bone breaks from an event that would not usually break a healthy bone. For example, falling from standing height and breaking a wrist, hip, shoulder, or spine, or having sudden severe back pain after bending, lifting, coughing, or twisting. This kind of fracture is not just bad luck. It can be a signal that the bone was already too weak. The most common places are the wrist, hip, and spine. Hip fractures are especially serious for older adults because they can lead to surgery, loss of mobility, long recovery, and a higher risk of complications. That is why preventing the first major fracture is so important. If you have already had a fracture from a minor fall, do not treat it as an isolated event. Ask your doctor directly, should I be evaluated for osteoporosis? Many people get the fracture treated, but never get the underlying bone weakness evaluated. That is a missed opportunity. A fracture can be a warning sign that the whole skeleton needs attention. Warning sign number 4 is muscle weakness, leg fatigue, cramps, or feeling unsteady. At first, this may not sound like a bone problem, but bones and muscles work together. Strong muscles help protect bones. Strong legs help you climb stairs, stand from a chair, carry groceries, and recover your balance before you fall. Weak muscles increase fall risk, and falls are one of the biggest reasons weak bones turn into broken bones. Many older adults notice small changes first. The stairs feel harder. Walking uphill feels more tiring. Getting out of a low chair takes more effort. The legs feel less steady. The body feels weaker than it did a few years ago. Some people also experience frequent nighttime leg cramps. Cramps can be related to many things, including dehydration, medication effects, nerve issues, circulation problems, or mineral imbalance. They do not prove osteoporosis, but if cramps appear together with weakness, poor balance, low activity, poor nutrition, or a history of falls, it is a sign to pay closer attention to your overall bone and muscle health. There is a dangerous cycle that can happen after 60. Bones get weaker, muscles get weaker, balance gets worse. Falls become more likely. And if a fall happens, a fracture becomes more likely. The way to break that cycle is not only to take supplements, it is to rebuild strength and balance safely. Warning sign number 5 is brittle nails that split or break easily. This is the least specific sign on the list. That means it should not be used to diagnose weak bones. Nails can become brittle for many reasons: aging, dry skin, frequent hand washing, thyroid problems, iron deficiency, low protein intake, certain medications, or normal nail changes. But nails can still be a small window into overall nutrition. If your nails suddenly become thin, brittle, cracked, or split easily, it may be a reminder to look at the bigger picture. Are you eating enough protein? Are you getting enough vitamin D? Have you had unexplained weight loss? Are you avoiding dairy or other calcium-rich foods without replacing them? Are you spending almost all day indoors? Have you had a bone density test if you are at risk? Again, brittle nails do not mean osteoporosis by themselves. But when they appear with other warning signs, they can be part of the story. Now that we have covered the 5 signs, let us talk about what actually helps protect bone health. The first foundation is calcium. Calcium is one of the major minerals in bone. Many adults need around 1,000 milligrams of calcium per day, and some older adults may need closer to 1,200 milligrams, depending on age, sex, diet, and medical guidance. But calcium is not just a pill. Food sources can include milk, yogurt, cheese, calcium-set tofu, leafy greens, canned fish with soft bones, fortified foods, almonds, and other calcium-containing foods. If you cannot get enough calcium from food, ask your healthcare professional whether a supplement is appropriate. Do not simply take large doses on your own. More is not always better, and supplements can interact with some medications or medical conditions. The second foundation is vitamin D. Vitamin D helps the body absorb calcium. Low vitamin D is common in older adults, especially in people who spend little time outdoors, live in northern climates, have darker skin, cover most of their skin, or have certain medical conditions. Food sources include fatty fish, egg yolks, fortified milk, and fortified foods, but diet alone may not be enough for some people. Ask your doctor whether you should have your vitamin D level checked and whether supplementation is appropriate. The third foundation is protein. Many people think protein is only for muscles, but bone also needs protein because bone is not just mineral. It has a living matrix that requires amino acids. After 60, too little protein can contribute to muscle loss, weakness, poor recovery, and higher fall risk. Practical protein foods include eggs, Greek yogurt, cottage cheese, fish, chicken, turkey, beans, lentils, tofu, edamame, and lean meats. If you have advanced kidney disease, your protein target needs medical guidance. The fourth foundation is exercise. Bones respond to use. If you never challenge your bones and muscles, the body receives less signal to maintain strength. For many older adults, the safest starting point is regular walking. Walking is weight-bearing, easy to begin, and good for heart health, mood, and balance. But walking alone may not be enough. Strength training matters because stronger muscles help protect the skeleton. Simple exercises can include chair stands, wall push-ups, step-ups, heel raises, resistance bands, seated leg lifts, and gentle squats while holding a stable chair. Balance training also matters. Practice standing with feet close together, standing on one leg while holding a chair, heel-to-toe walking, or Tai Chi if it is available and safe for you. The goal is not to become an athlete. The goal is to reduce the chance of falling. If you already have osteoporosis, a previous fracture, dizziness, severe arthritis, heart disease, or balance problems, ask a clinician or physical therapist before starting a new exercise program. Some movements may need to be modified. For example, people with spine fractures or severe osteoporosis may need to avoid heavy twisting, deep forward bending, or high-impact jumping unless cleared by a professional. The fifth foundation is fall prevention at home. This may sound simple, but it can save a life. Remove loose rugs or secure them. Keep walkways clear. Use night lights. Install grab bars in the bathroom. Use non-slip mats. Keep frequently used items within easy reach. Have your vision checked. Review medications that may cause dizziness or sleepiness. Wear supportive shoes instead of slippery slippers. Many fractures do not happen because someone did something extreme. They happen because of one ordinary fall in an ordinary home. The sixth foundation is avoiding habits that weaken bone. Smoking can accelerate bone loss. Heavy alcohol use can interfere with bone metabolism and increase fall risk. Too much inactivity weakens both muscles and bones. And very restrictive diets can leave the body without enough building materials. Bone health is built through repeated daily choices. Not one magic food, not one supplement, not one exercise. It is the combination that matters. So let us summarize the 5 warning signs again. Number 1. Unexplained back pain, height loss, or a more rounded upper back. Number 2. Loose teeth, receding gums, or dentures that no longer fit well. Number 3. A fracture from a minor fall or small movement. Number 4. muscle weakness, leg fatigue, cramps, or poor balance. Number 5. Brittle nails, especially when combined with other signs of poor nutrition or bone risk. If you notice one of these signs, do not panic. But do not ignore it either. Ask about bone density testing. Ask whether your calcium, vitamin D, protein intake, medications, fall risk, and exercise routine should be reviewed. Your bones are not dead structures. They are living tissue, and living tissue can be supported. The earlier you pay attention, the more chance you have to protect your mobility, independence, and confidence. If you are over 60, start with one step this week. Measure your height. Add one protein-rich food to breakfast. Take a safe walk. Practice chair stands. Check your home for fall hazards. Or schedule the appointment you have been putting off. Strong bones are not only about avoiding fractures. They are about keeping the freedom to walk, travel, cook, shop, play with grandchildren, live independently, and enjoy your life with less fear. Which of these 5 signs surprised you the most? Let us know in the comments. If you found this helpful, subscribe to Decode Your Health for practical, evidence-informed guidance on healthy aging after 60. Thanks for watching, and take good care of yourself.